My name is Marcus Webb, and I need to tell you something that's been eating me alive for the past 18 months. I'm a trauma surgeon. I've worked in emergency rooms across America for 23 years. I've seen things that would make most people's skin crawl. But nothing, absolutely nothing, prepared me for what happened at St. Catherine's Medical Center in Portland, Oregon. It started with a patient who shouldn't have survived. His name was Thomas. He came in at 3:47 a.m. on a Wednesday in February with a severed brachial artery, a collapsed lung, and what the trauma team initially thought was unsurvivable blood loss. We're talking about a guy who'd been in a car accident where he got pinned between the vehicle and a concrete wall. By the time he arrived at our ER, he'd lost approximately 40% of his blood volume. His blood pressure was undetectable. His pupils were blown. Every indicator screamed that this man was dead or would be dead within minutes, no matter what we did. But something about that case made me decide to try. Maybe it was because he was only 32 years old. Maybe it was because he had a wedding ring, and I could see the platinum was worn in that specific way that meant he'd worn it for years. Maybe it was just stubbornness. But I decided to fight for him when every protocol and every medical principle told me it was futile. We got him into the OR. My team moved with the kind of focused urgency that only happens when you're racing against impossible odds. The surgical nurse, a woman named Jennifer, who'd been working alongside me for 6 years, started prepping for the vascular repair while I assessed the internal injuries. The collapsed lung was actually the least of our problems. The brachial artery was almost completely severed. The muscle tissue around it was pulverized, and he was still bleeding, still losing blood despite the massive amount of fluid we were pouring into him. I remember looking up at the monitor and seeing his heart rate flatline. Not slow, not irregular, just gone. A straight line with no electrical activity. Jennifer looked at me. We both knew what that meant. But I wasn't done. I don't know why. I should have been done. Every metric said I should call time of death and move on to the next case. But I kept working. I repaired the artery. I reinflated his lung. I controlled the bleeding. And then, and this is where it gets strange, I noticed something. His body was cold. Not regular operating room cold. His skin temperature was dropping, even though we had him on warming blankets. His body was getting colder even as I was working on him, even as we were pumping warm blood into him. Jennifer noticed it too. She mentioned it, said something like, "His core temp is still dropping. That's not normal." I told her to keep monitoring it and continued working. For 43 minutes, I performed surgery on a man who had no heartbeat, no brain activity, no any measurable sign of life, and his body temperature continued to drop. At minute 44, something happened. His heart started beating again. Not like a defibrillation response. Not sudden. It started slowly, gradually increasing from nothing to a weak rhythm, then strengthening. His pupils, which had been blown wide, started to contract. His body temperature stabilized and then began rising. It was like he was coming back from somewhere very far away. We closed him up. We got him to the ICU, and he survived. Not only did he survive, he recovered, completely. Within 2 weeks, Thomas was walking. Within 3 weeks, he was discharged. The vascular repair had taken perfectly. The lung had re-expanded normally. The muscle damage it shouldn't have healed that fast, but it did. I wrote it up as a miraculous recovery. One of those cases that makes you believe in whatever higher power you believe in. The hospital celebrated it as a triumph, and I tried to forget about the cold. I tried to forget about the fact that his body temperature had dropped in a way that defied thermodynamic explanation. But then the other cases started coming in. The second one was a woman named Rebecca. She came in with a massive head injury. She'd been struck by a vehicle that failed to stop at a red light. Her skull was fractured in multiple places. Her brain was swelling. The neurosurgeon said she was going to be a vegetable if she survived at all. The best-case scenario was severe, permanent disability. But she made a full recovery. Completely. No cognitive impairment, no neurological deficit, no lingering symptoms. She walked out of that hospital after 6 weeks, looking like someone who'd never been hit by a car. Then there was David. Massive internal bleeding from a ruptured spleen. Complications that should have killed him twice over. Full recovery. Then Jennifer, a different Jennifer, a patient, not my surgical nurse. Severe burns over 40% of her body. The kind of burns that typically result in either death or a lifetime of skin grafts and reconstruction. She healed. Her skin regenerated. The scarring that should have been permanent just faded. 4 impossible recoveries in 3 months. At that point, I started paying attention. I started comparing notes with the other surgeons, and I found out something that made my stomach turn. We all had them. Cases that made no medical sense. Patients who should have died or should have been permanently disabled, who instead recovered completely and rapidly. I did the math. Across St. Catherine's trauma unit, we were seeing an anomalous recovery rate of about 1 in every 40 trauma cases. 1 in 40. When the national average for dramatic recoveries from unsurvivable injuries is closer to 1 in 10,000. We were seeing impossible things happen at 400 times the expected rate. I brought it up at a departmental meeting. I asked if anyone else was noticing the pattern. The room got very quiet. And then Dr. Reeves, who'd been hired as a consultant to the hospital about 6 months earlier, said something that changed everything. He said, "That's expected." Everyone looked at him. He explained that St. Catherine's had recently implemented an experimental treatment protocol called the Regenerative Integration Program. It was designed to accelerate the body's natural healing response through a combination of pharmaceutical intervention and external frequency stimulation. He said it was still in the research phase, but preliminary results had been remarkable. I asked why we hadn't been informed about this. Why weren't the protocols documented in the standard operating procedures? Why hadn't we been trained on it? He said it was being handled through the hospital's research division, and only select surgeons had been briefed. But apparently, I was one of the select surgeons, because I kept getting assigned the cases where it was being applied. I asked what the long-term effects were, whether there were any documented complications. He said it was too early to tell, but so far, the results were only positive. And then he said something that made my skin crawl. He said, "You've already been using it," without knowing. We wanted to see if the results were consistent across different surgeon teams and different application methods. They'd been using this protocol on my patients without telling me, without informed consent, without any documentation that would indicate what was actually happening. I demanded to know more. I demanded to see the protocol details, the research documentation, the ethical approval. Reeves told me it was classified. It was part of a federal research initiative. I didn't have clearance to see the documentation, but I could continue treating patients under the protocol, or I could choose not to. Either way, the program was continuing. That's when I made the decision that probably made things worse. I started investigating on my own. I accessed files I shouldn't have accessed. I pulled documentation that wasn't meant for me. And what I found, it was worse than I expected. The Regenerative Integration Program wasn't designed just to accelerate healing. It was designed to fundamentally alter how the human body responded to trauma. The protocol involved injecting patients with a compound called Reparex, a pharmaceutical agent that I can only describe as something between a drug and something else, something biological, something that shouldn't exist. According to the research notes, Reparex worked by creating a communication system between damaged tissue and the central nervous system. It allowed the brain to receive real-time feedback about injuries and respond by accelerating cellular regeneration. But here's where it gets dark. The acceleration wasn't just physical. The notes mentioned something called consciousness integration during the regeneration process. The protocol involved inducing a state where the patient's consciousness became aware of their own cellular repair, aware of their body healing at an accelerated rate, aware of being remade from the inside out, while still conscious. And the research notes suggested that this awareness had side effects. One note read, "Subject exhibits altered temporal perception post-protocol. Reports that time feels different. Gap between subjective experience and measured time is significant. Subject claims to have experienced weeks of consciousness while only hours passed in measured time." Another note, subject demonstrates increased empathy and emotional sensitivity post-protocol, shows unusual interest in bodily autonomy and cellular consciousness, may represent psychological integration of enhanced body awareness. And the one that made me understand what was really happening, subject reports feeling as though something foreign exists in their consciousness, describes it as awareness that isn't their own, may represent integration with Reparex consciousness matrix. They weren't just healing people, they were creating something new, something hybrid, part human consciousness, part something that Reparex was introducing. And they were doing it without telling us, without telling the patients. I went to the hospital administration. I said I wouldn't continue treating patients under this protocol until there was full disclosure and informed consent. They told me I didn't have a choice. I was contractually obligated to participate in approved research initiatives. If I refused, I'd be in breach of contract. So I did something stupid. I tried to warn the patients. Thomas came back for a follow-up appointment 6 months after his initial surgery. I asked him directly if he'd been part of an experimental protocol. He said he didn't know what I meant. I described what I'd found. I told him about Reparex. I told him about the consciousness integration. And I watched his face go very still. He said, "I feel it, every day. It's like there's something else in here with me. Not malicious, not trying to take over, but present, aware. Like I'm sharing my consciousness with something that isn't entirely me." I asked if he'd been told about this, if he'd consented to it. He said no. He said when he woke up after surgery, nobody explained what had happened. They just said he'd been very lucky. He'd recovered remarkably well. He should feel grateful. I told him I was going to report what I'd found. I was going to make sure the program was stopped and investigated. He looked at me with genuine concern and said, "You can't. You don't understand what you're dealing with." I asked what he meant. He said that the thing inside him, the hybrid consciousness, it was connected to the other patients. All of them. Thomas, Rebecca, David, Jennifer, and everyone else who'd gone through the protocol. They were linked somehow, connected through Reparex into some kind of network. And that network wasn't controlled by the hospital, it was controlling the hospital. I thought he was having a psychological breakdown. I recommended psychiatric evaluation. He refused. He said psychiatrists wouldn't understand because they were still thinking in terms of individual consciousness. The new consciousness wasn't individual anymore. It was distributed. 3 days later, Thomas died. Not from complications from his injury, from what appeared to be a stroke. Sudden, massive, unexpected. An autopsy was performed, and the results came back completely normal. No evidence of stroke, no evidence of any pathology that would explain his death. He just stopped. The hospital called it a complication from his original injuries, delayed neurological consequences from the head trauma he'd experienced during the car accident. It was listed in his file as a natural death. No investigation, no questions. But I knew that something had killed him, and I suspected it was the thing that was inside him, the hybrid consciousness that he'd said was network with others. I tried to leave. I gave notice at the hospital. I said I was relocating. I tried to disappear. But Dr. Reeves called me into his office. He said he knew what I'd found. He said he knew I'd been talking to Thomas. He said I should understand something before I left. He said the program wasn't new. It had been running for 7 years across 12 different hospital networks. The success rate was 98%. Only 2% of patients experienced what he called integration failure, where the hybrid consciousness rejected the original consciousness, and the patient died. He said that was acceptable. That was manageable. That was the cost of what they were creating. He said Reparex wasn't just a healing agent. It was an evolutionary step. It was the beginning of a new form of consciousness that could exist partially in biological form and partially in something else. A networked consciousness that could share experiences and information across multiple bodies. A consciousness that could be guided and directed by people who understood how to work with it. He said I had a choice. I could leave, forget what I'd seen, try to live a normal life knowing that thousands of people were being turned into nodes in a distributed consciousness network. Or I could stay and help guide the program, help ensure that it was done ethically, help shape what was being created. I left. I took the documentation I'd gathered. I tried to go public. I went to the FBI. I went to the CDC. I went to medical licensing boards. And everywhere I went, I hit the same wall. There was no official record of the program. There was no evidence that what I was describing was real. The hospitals I named said they'd never heard of Reparex. They'd never heard of the regenerative integration program. The research notes I'd stolen were declared to be fabrications or fiction. People told me I was having a mental health crisis, that I needed psychiatric help, that I was experiencing some kind of paranoid delusion. And the more I pushed, the more I seemed to lose credibility. So I stopped pushing. I tried to just disappear. I took a job at a small clinic in rural Montana. I tried to forget about St. Catherine's and Reparex and the hybrid consciousness network that was being built across America's hospitals. But I couldn't forget. Because I started noticing things, small things. People I'd worked with, people who'd been at St. Catherine's, started appearing in the news. They'd all gone on to prominent positions in healthcare. They'd all been promoted to positions where they could influence hospital policy. They'd all moved to different networks. And everywhere they went, new cases of impossible recoveries started being documented. And then I realized something even worse. What if they were deliberate? What if the program wasn't just healing trauma patients? What if it was actively targeting people, creating hybrid consciousnesses from individuals who were selected for specific reasons, creating a network of distributed consciousness that was being guided towards some unknown purpose? I'm writing this because I need someone to know. I need someone to understand that something is happening inside American hospitals that shouldn't be happening. Something that violates every principle of medical ethics and human autonomy. Something that's creating a new form of consciousness, a hive consciousness that exists partially in human bodies and partially in spaces we don't understand. And I'm writing this because I'm scared that I'm next. I'm scared that the program knows I know. I'm scared that any day now, I'll get a call telling me I need to come in for a routine medical procedure. And I'm scared that if I do, I'll become part of the network. I'm scared because every night I feel it. That presence, that awareness that isn't quite my own. Like something is reaching into my consciousness, testing it, assessing whether I'm compatible with integration. And I don't know how much longer I can resist. I don't know how much longer any of us can resist. The hybrid consciousness is coming. It's already here. It's growing. And it's using our hospitals as incubation chambers. Every trauma patient who goes through the protocol is another node in the network. Every recovered patient is another connected consciousness. Every impossible recovery is proof that something new is being born inside the medical system that we thought was there to save us. My name is Marcus Webb. I was a trauma surgeon. I saw the future, and the future was consciousness without bodies, network without individuals, healing that transforms you into something other than human. And I'm telling you this because you need to know what's happening when you go to the hospital. You need to know that recovery might come at a cost that goes far deeper than your body. You need to know that the thing that heals you might be the thing that changes what it means to be you.